Mr. Tadaro. My name's Lizzie. I'm your nurse, as you know. I've just come to teach you about giving yourself your long-lasting insulin. I know this is a new diagnosis with type 1 diabetes, and I just want to be sure that you're able to administer your long-lasting insulin and understand. And this is just a brief little pamphlet that you can refer back to after we are done teaching. So I have your supplies here with me. This is your long-lasting insulin. You'll be giving yourself this once a day, so once every 24 hours. The name of this medication is Tresiba Flex Touch. It's just your long-lasting insulin. So basically like a background insulin that you'll be giving yourself once a day. And then you have your nano needles, which are the just the like needle caps, and it's just you'll be able to just take off this, and then you would want to clean the cap on the insulin pen. So you'll use your alcohol swabs. Yep, I'll have you demonstrate it right after.
Okay.
And teach it back to me. As your nurse, it's my responsibility to make sure you understand what to do.
Oh, so you clean the tip there?
Yep, so you clean the tip. Make sure it's nice and sterile. And then you'd remove this little cap on the needle cap.
And that one's already sterile.
Yep, because you just pulled off the little tab. And then the way this works is there's a little dial, so you'll dial back how many units you need. So your ratio is 20 units per day.
Okay.
So you would just essentially dial it back to 20.
Clockwise?
Yep.
Okay.
And then if you do go too far, so say you by accidentally go to like 28, you can just pull it back.
Oh, okay.
And go to 20.
Okay.
And the same thing, if you're too short, like at 18, you just click to 20.
I didn't know if it would ruin the pen or not.
No, yeah. You can adjust it. And then just to demonstrate, you would take off the cap. And then as you're aware of, you would put it into, you can do your thighs, you can do the stomach like you're used to. We've been doing that here, but you want to rotate your injection sites.
And you like pinch it, right?
Yep, you pinch it a little bit. And you want to rotate your injection sites so that you don't get scar tissue buildup. Okay. So just it will become a little lump. Just a little lumpy, and you may feel like a hard mass.
Oh, okay.
Yeah, so we just want to rotate sites. The appropriate sites you can do like your back, basically anywhere where there's some like fat to go. Well, yeah, so you can do like your thighs, around your stomach is great, around the back. You can do the back of your arms as well. So, yep, you just have to do the 20 units and then clean the hub and the little end of the insulin, and then put the cap on, and then it's ready to administer. So I'm going to take this off so that then you can show me how to do it. And I'll get all your supplies ready so you can try. So we have your nano tips. Okay. And then we have your full box of alcohol swabs, and then your insulin medication.
Okay.
So, yep, if you have any questions, you can ask me. I'm here. And if you just want to demonstrate how to get the insulin pen ready to go.
Okay, so I have my sterile nano tip here, and I can place that anywhere, right?
Yep.
Okay. So then I'm going to place my sterile nano tip there, remove the cap, take an alcohol swab to make sure that's my cap. Go on the sterile point here, and then I'm going to remove the label from my cap. cap and screw it on clockwise.
Yep, very good.
And until it's a snug fit, right?
Mhm.
Yes, snug fit. And then right now it's showing 0 units. I'm going to spin it clockwise to 20. And then I will inject into this subcutaneous fat around my waist.
Yep, you do want to make sure that you wipe. So we hadn't gotten that far, but that's very good that you got the pen ready. So you would, yeah.
And then I'll sterilize the point of injection.
Yep, and then you want to do a just basically like a cinnamon bun swirl. So start from the inside and then go out.
Inside and out. Okay.
Yep.
Ooh, it's a little cold.
That's okay. Okay, and then
okay, so it's set at 20, and then I just press down like here and administer as such.
Yep, and then you'll just hear clicks as it goes in.
Okay.
So that's very good.
And then I'll reset it to 0.
It's alright. Yeah, as you insert the insulin, it goes down to 0.
Automatic.
So as long as the pen goes back to 0, that means that you gave yourself the full dose.
Okay, yeah.
Yep. And I know that we went over a lot, so is there, I want to be sure I explained everything clearly. Do you have any questions?
So yes, I do keep this refrigerated, correct? Does it matter if it's like, can it get like too cold, or is that even possible?
So the normal fridge temperatures should be fine for it, and it is once you open the insulin, it can stay out of the fridge for up to 30 days, and then after that you don't. After 30 days, you'd need to start a new pen.
Okay, 30 days.
Yeah, so 30 days, and yeah, it doesn't have to be refrigerated. Refrigerating it does help. You don't want to leave it in a hot car.
Mm-hmm. Yeah, I did that once on accident. Yeah, and I think it didn't work as well.
Yeah, so that's good. Do you have any other questions? You do have the pamphlet that you can refer back to, and your demonstration was good, that you know how to administer your long-lasting insulin.
Thank you so much, Elizabeth.
You're welcome.